Hey everyone, today we're going to be doing a step-by-step guide on how to microneedle at home. So these are the products we're going to be using today. We've got our gloves, our protective sleeve, M8S microneedling pen, 12-pin cartridges, alcohol, prep pads, hyaluronic acid, sodium chloride, our dressing pack, our sharps bin, and also our hydrating mask for after the treatment. So I've already double cleansed my skin and applied numbing. The numbing is optional. If you do have low pain tolerance, you can definitely apply that on the skin for 20 minutes before removing. Just keep in mind that each region uses different numbing brands or numbing cream. Just make sure that if you guys do use numbing cream, to remove it before you begin the microneedling treatment. If you don't have a sterile dressing pack at home, that's totally fine. You can use a small dish, just making sure you're disinfecting it before putting your hyaluronic acid serum inside. So we're going to first set up our microneedling pen, making sure that the depth is on 0 before attaching your pen. Pop the cap off. Now this is optional. The cartridges do come individually packed and sterile, but we want to give it a spritz. So again, optional, depending on which region you are, this is also different as well. With the hyaluronic acid serum, you don't want to be applying this directly to the skin. What we're going to do with our dressing pack is pouring a little bit into that compartment right there. Before we begin the treatment, we do want to wipe the skin over with the prep pad. This is pretty much just alcohol and chlorhexidine, making sure that when you're wiping around the nose to hold in your breath. So there's 2 ways you can apply the hyaluronic acid serum to the skin. If you're using the sterile pack, you can just fold the cotton pad here with the tongs, dip it in and apply as you go. Or if you're not using the sterile pack and you're using the dish, you can just dip your fingers into the dish and apply it to your skin with your fingers, but ensure you have gloves on. I'm going to start with the under eyes and the upper lip because we're starting at a lower depth in those areas. Just applying the serum to the under eye area. For these areas, you want to use a depth of 0.25 millimeters and speed 1. So before you adjust the depth and the speed, turn the pen on, adjust it to 0.25 and leave it on speed 1. So we're going to use a cross-hatching technique for the under eye area. Make sure you're doing it away from the eyes. So that's one pass, and we're going to do another pass. And that's one section done. We're going to go on the other side. And that's the under eye area done. We're going to keep the same settings and do the upper lip. And we're going to do the other side. Second pass. Once you've done the under eyes and the upper lip, we want to do the forehead, the nose, and the chin. With these areas, we recommend 0.5 millimeters in depth and turn the speed up to a 6, anywhere between a 3 to a 6. You want to work the forehead also in sections, whatever you're comfortable with, and we're going to do the cross-hatching technique again. So that's vertical, horizontal, and then diagonal in one direction, and diagonal in the other direction. So again, that's your one pass. We're gonna go do the second pass, reapply hyaluronic acid if you need to, and doing the cross-hatching technique again. You should start seeing some redness and very little to mild pinpoint bleeding, which is what you want to see. And then we're going to move on to the next section of the forehead. And again, cross-hatching technique 2 times. So that's the other side of the forehead done. We're going to move on to the nose. And again, starting on one side first, keeping the same setting. The other side. Nose done. And that's the chin done. We're gonna move on to our cheeks. I'm gonna start on one side, again, breaking the area into sections. We're going to break it up into 4 sections. So starting in the outside, moving inside, and then bottom, and then inside. For the cheeks, we want to increase the setting to about 0.5. You can keep 0.5 or increase to about 1. I'm going to increase mine to 1 millimeters and still on speed 6. And that's the upper cheek done. We're going to move on to our neck. I'm going to keep the settings the same. I'm going to go underneath the chin and the jawline first. When we're moving onto the lower part of the neck, make sure you're avoiding the middle. That's where the thyroid is, so we don't want to go over that area. Once you've covered all the areas, we are going to spot treat. What that means is where you've got areas of concern, we're going to go over it again with the stamping method. For example, I've got a little scar here on my chin. I'm just going to wipe over that again with hyaluronic acid. I'm still keeping it on 1.0 millimeters, and we're just going to stamp until we get more of that pinpoint bleeding. I'm also going to go over my cheeks again just here. If it's not giving you pinpoint bleeding, you can always increase it by 0.25 millimeters at a time and go over it again. So right now it's on 1.25 millimeters. I'm starting to get a little bit of pinpoint bleeding, which is what you want to see. And I'm also just going to go on this side as well. And I'm going to do the same for my neck where I've got all that scarring that's there. And the same on the other side. Once the treatment is done, you want to grab your sodium chloride, crack it open. You want to pop it into the other compartment of your dressing pack using a new pair of tongs and a new cotton pad. I'm going to fold it the same way, popping that into the sodium chloride and wiping over the skin just to remove any pinpoint bleeding and disinfecting the area as well. You can wipe it over again a second time with another cotton pad. Just want to make sure everything's clean. Once everything's wiped off, you just want to reapply the hyaluronic acid serum onto the skin. This part is optional, but is recommended if you want to apply a hydrating mask onto the skin after the treatment to cool the skin down. We recommend about 20 to 30 minutes. After that, you remove it and just rub in the remaining products left on the skin, and then apply your hydrating, soothing moisturizer on afterwards. Done. So to end the treatment, you want to remove the cartridge safely. If you don't have a sharp spin, you want to pop the cap of the cartridge back on, remove it, and you want to put it back into the little pack that it came with and safely dispose into the bin. If you do have a sharp spin, you can pop the cartridge right into the bin, just making sure the cap is off the cartridge. You want to remove the plastic sleeve and then disinfecting it with the prep pads again. And then everything that's still on here, removing your gloves and close the dressing pack. Just like that. So in the video, I used the depth of 0.25 millimeters and speed 1 for the under eye area and the upper lip. For the forehead, nose and chin, we use 0.5 millimeters and speed 6. And then for the cheeks and the neck, we did 1 millimeter and kept the same speed. Just keep in mind that everyone's skin reacts differently. So if you're using these depths and you don't get an endpoint, that is even redness and mild pinpoint bleeding, you can increase by 0.25 millimeters at a time. If you are experiencing a lot of bleeding, you can decrease by 0.25 millimeters at a time.